The topic for my presentation today is the ethical responsibility of physicians in the care of enemy combatants. To prepare you for that specific topic, I'm going to talk about some of the big issues in military medical ethics that have existed really since 1977 to set a background for going on and discussing some of the more current questions that have arisen since 9/11. Let us first talk about what the controversy is all about here. It's one that's obvious to all of you, I'm sure, but it's worth tagging before we begin. And that is, how is it different for military care providers as opposed to civilians? Well, obviously, the mission of the military in some contexts, when diplomacy doesn't work out, is battle. And of course, the outcome to soldiers and enemy soldiers can be their death. Doctors' normal course is, of course, to further the sanctity of life. So those are pretty much opposites that military care providers must contend with. Now, some organizations centuries ago have said that, well, to avoid the doc being in a double bind, being in the military whose mission could be to take life, and docs whose primary mission is to save life, maybe military doctors should be neutral, such as all being in the Red Cross. Well, that has some pluses and some minuses we won't go into right now. You can perhaps imagine what they would be. It's a sort of interesting discussion, and persons discussing this battled it out. But we'll simply note that as a way of tagging the chief dilemma going on here before we go further. What is the rationale for docs being in the military and serving in the military? Well, assuming that it's a fair or a just war, that should be, one's forces need all the medical care they can get. One need merely pick a war such as World War II and the importance of preventing genocide to make that point. Now, what is one of the practical concerns that comes up here in deciding what policies to implement? Well, a big question is who should decide. In theory and reality, the military serves the greater society. So fine, the greater society should decide what ethically military docs and the military can and should do. But there are questions as to how do they decide that on an ongoing basis. And typically, what the government does then is it has administrative bodies who carry out and implement the policies that others, Congress and the President, enact. Well, there's a distrust that sets in there, which is as follows. People in the military at the highest levels are likely to say, well, civilians don't really understand some of the real issues we run into at the front, and so they're going to make decisions according to ideas that they have, and that's fine, but they may miss the boat in a way which is seriously problematic. On the other hand, civilians say, well, the military personnel at the highest levels may have their own bias, which is a military bias towards furthering the military missions, even at the expense of certain other important ethical concepts and values that should be on the table. So we'll return to that issue of who should make what decisions when. Now, let us begin with some of the specific ethical problems that military physicians can run into. And we'll start sort of basic and work down to more and more specific. When soldiers are injured in combat, and they come out of combat with whatever it is, and the care provider treats them, and then they return to combat, docs are implicitly doing something quite different than what they do when they're treating civilians in civilian settings. That is, they're implicitly being a chain in the link of events that could lead to the soldier's death. That is to say, the soldier is not going to a bed to get well. If the soldier is well enough, the soldier goes back to duty, and the soldier may get killed. The decision of who goes back to duty when, with what sort of injuries, is actually made by the commanding officer, and so technically the military care provider is healing the soldier, and then it's up to the commander to decide, based on how the soldier is, whether the soldier should go back to duty or not. There have been some classical times, such as during World War II, where soldiers, even though perhaps having a temperature, went back to fight because they were needed there, so that it can be that even with some degree of illness, the soldier might be needed at the front. That's the commander's decision. What's the justification for military care providers possibly being a link in the chain that leads to the soldier's death? Well, as we said before, if it's a just war, the end here justifies that. If one again thinks of just World War II and genocide, that's a self-evident answer. In the military, representing that fundamental difference is something called the military medical triage principle. And what that says is that military care providers have two priorities. One is to further the mission of the military when necessary. That's what the military is all about, winning wars when necessary. The other is to do the greatest good for the greatest number, which might come out to be saving the greatest number of soldiers' lives or to save soldiers from serious injury. The second of those priorities you will recognize is very similar to civilian doctors during disasters. That is, they may abandon the traditional notion of treating those individuals right before them that are injured worst and in most danger of, let us say, dying, to be able to treat more people and save more lives by treating those with lesser injuries because they can treat greater numbers. Now, this conflict between saving the most people and furthering the mission that potentially exists has come about sometimes. I'm going to give you one example, my purpose being that you can get clear on the principles in conflict here, just as all of you studied physics, I imagine, and then you recall there were billiard balls on a frictionless plane, and you were trying to figure out what angles they'd go off at. Of course, in reality, there was no frictionless plane. So in the same way, we're looking at a specific example to get clearer, as clear as we can be, about the principles that are in conflict. This happened during World War II. Penicillin had just been invented. It was just going out in minor amounts to military doctors and others to treat infections. And there was just a little bit that military care providers had during World War II. They had some injured soldiers, some of whom were dying from their injuries, and it looked like penicillin could save their lives. Now, as it happens at USIS, often there are military physicians who've been in the military a long time or a long time ago. So I've had the fortune of having some of these people who were there in World War II at the time share with me their experience with penicillin, and military care providers were very unsure how they were to use it, what sort of doses to use, and so on. Perhaps worth keeping in mind. Well, the Germans were also pursuing the war, and in one of the medical facilities, there was also a great need to treat a number of the soldiers who had venereal disease, which interfered with their being able to fight effectively, they needed penicillin too. Who should get it? Those who were dying without it, or those who had venereal disease so that they could then go on and carry on the fight? And this was not, well, it would be nice to have them carry on the fight. They were desperately needed, I'm told. So the decision was made, and there's some academic debate about at what level this decision was made, and it was made to treat the soldiers who could go back to the front. Some of you might say, perhaps that was justified because otherwise everybody could have died if the medical facility was overrun, and that theoretically is a fair enough position here. But what it illustrates is how that conflict can work. Well, one thing I'd like you all hearing this to know is a subtle point that might not be self-evident, that serves to give some sound rationale to what happened at that time in the military. And this involves the principle of equity, or treating people equally, or some would say justice, though keep in mind that justice can have very different meanings. It can mean treating people equally, the principle of equality. It can mean treating people fairly. In the law, treating people fairly is giving them due process, allowing someone to examine witnesses if someone is in court. That's not the meaning we're referring to here. Here we're referring to equity or treating people equally. Now, when people come into the military, they agree, at least implicitly, that they may, if necessary, give their life for the greater society. That's what soldiers acknowledge when they come in the military. That's why we owe soldiers as much as we do. They're giving their life, potentially, for us. Well, the question that arises here ethically is, at what point is a soldier taken out of that contract, where he or she no longer might give their life for the greater society? One might think it's once one comes from combat to the military care provider. But note that it needn't be that way. It could be that even after being seriously injured, one is still in that group of soldiers who may have to give their life for the rest of the society, if that's necessary to win the mission. If you look at that perspective, then those who were dying and needed penicillin were still in that group who had committed themselves to give their life, if necessary, for the mission. So there's that potential ethical justification for putting the mission first in that context. Going on to a more specific example, one that, in my view, there's a fair bit of confusion as people think about it, and that's combat fatigue. Now, these days, battle has changed, to be sure. But over time, and here I refer to World War II and some of the wars since then, when soldiers experienced what was called combat fatigue, now acute stress syndrome, over time post-traumatic stress disorder. It used to be when they came in with combat fatigue, what was learned during World War II was that if docs removed patients, soldiers, from the front and, for example, sent them back to the States, they might develop more severe symptoms over longer time, presumably due to survivor guilt. That is, the soldier might have an injury over in Germany, for example, come back to the States, and then his buddies or her buddies, depending on the circumstance, could all be killed, or some of them could be killed. And the soldier who returned to the States might think, gee, I survived, they didn't, maybe I could have gone back to duty, how come I'm alive, they aren't? And those sort of feelings could lead to permanent psychiatric sequelae. There may be some question of empirically what percentage of soldiers develop survivor guilt and how much worse is it and so on. But nonetheless, regardless of what the data proves or doesn't, that's been a rationale that military care providers have often adopted as they treat soldiers that come in with combat fatigue with the expectation that they'll be returning to their unit. And then with perhaps 2 or 3 days of hot meals and some sleep, the soldiers are expected to return to combat and often do. That might be different from what civilian docs or care providers might do when the civilian patient comes in traumatized by something that's happened. The civilian doctor might not send those patients back to the scene where they could be re-traumatized and might be afraid of it. A question: what is the ethical justification for military care providers treating soldiers with that expectation when they might not do that as civilian care providers? As I've suggested, the common rationale given for that is that that saves the soldier from more permanent, serious psychiatric injuries such as post-traumatic stress disorder due to survivor guilt. There's a problem with that, however, ethically. That is, if the military care provider said to the soldier, which would you like? To go back to the States, even though you might have more permanent and severe injury, or would you like to go back to combat? The soldiers might very much say, I'll take my chances on going to the States because I'd rather go that way than take the risk of dying during combat. In civilian settings, one would respect a patient's autonomy even though they might have an anxiety or depression syndrome. So that justification, saving soldiers from survivor guilt, might not be sufficient. That would be, in fact, a paternalistic judgment of military care providers of what's best for the soldier, regardless of what the soldier wants for him or herself. That argument, paternalistic judgments, is open to question, though it's important that you all know that all paternalistic judgments aren't necessarily flawed or wrong. Well, is there another justification for military doctors treating soldiers with the expectation of returning to combat? The answer is yes. That is, it was also found out during World War II that if soldiers coming in with combat fatigue are relieved of going back to combat, other soldiers might unconsciously or consciously, for what psychiatrists call secondary gain, might develop symptoms. The mind can do that, so that if you send some people from combat back to the States, it might be that the next day or week there are larger numbers of others, and you might decimate your troop strength and then lose the mission with, of course, the type of results I've referred to before, as in World War II, perhaps genocide. So a justification for military care providers treating soldiers with the expectation they'll return back to duty when they have combat fatigue is to avoid opening up the floodgates so that they can continue to try and win the mission.